The next thing we're going to talk about is infectious diseases. And I'm going to go fairly quickly through this because we have talked about this to some degree in talking about universal precautions and some of the other things that we've discussed. So there's different modes of transmission. I says 4 and then there are 5 listed. But there are different modes of transmission. They can be airborne, direct contact, bloodborne, water and foodborne. And I added vector-borne, although, that could fall into, contact with another organism or the blood of another one. So vector can fall into some of those, but because we covered it, I wanted to add it. It's the most important line of defense in preventing illness is always sanitary precautions and using those hand washing strategies, etc. So it's really important to be sanitary in terms of preventing the spread of disease. Universal precautions, as I just said, can prevent the transmission of most diseases. Personal hygiene is also critical. Hand washing. We talked about how to do that. And nutrition can also be important in helping keep the body resistant to some infectious diseases. There are many vaccines that are dependable and effective with minimal, if any, side effects. I know there's this whole discussion about, and has been for a long time, about the link between vaccinations and autism. There is no credible evidence to support that. We can talk about that in more depth, and that will probably be one of the topics that come up in the medical ethics course, but just know that there was no good research. It was very flawed from every aspect. It's been replicated and shown to be absolutely no link between vaccinations and autism. There's much more risk of not having the vaccinations and being exposed to some of the diseases that the vaccines are intended. So if you're an adult who was not immunized as a child, you need to get vaccinated, and especially if you're going to work in an area where you may be susceptible to the disease. Also, depending on what type of healthcare setting you work in, you may be required to get things like an annual flu shot, and you may just want to, even if you're not required, because you're going to be exposed to several different types of illnesses. I know that the first year I worked in a public school setting, I was sick all the time because you're exposed to things that you haven't been exposed to in the past. If communicable diseases, you as a potential healthcare provider have a legal obligation to report some of the medical conditions to public health authorities. Depending on your capacity, reporting them to a supervisor is essential. Supervisor would then report it on. I apologize for that. The rationale is you want to protect the public from an outbreak of the disease and generate data. How appropriate that I'm sneezing in the middle of reporting communicable diseases. There are health agencies, the Centers for Disease Control, for example, would be one location where you would report communicable diseases. And it's not the person that's reported, it's the disease that's reported to the appropriate agency. We've talked about influenza in the past. The seasonal flu results in several deaths and hospitalizations each year. There's A and B viruses of the flu. People are contagious from the first day before the onset of symptoms until up to 7 days after they realize they're sick. So your exposure to the flu can be long, and oftentimes people are exposed before the carrier or the person who's going to get sick even knows that they have it. Tamiflu has been shown to have some effectiveness, and we've talked about this. Some years, some strains of the flu, Tamiflu is more effective than others. Mononucleosis, often called the kissing disease, just because of the manner of transmission. It's transmitted through oropharyngeal contact, and it is caused by the Epstein-Barr virus. This is known, the hallmark symptom of mono is overwhelming fatigue and just the inability to get enough sleep. You are just exhausted when you have mono. There's also potential side effects like an enlarged spleen. Mono is something that is seen in the college athlete population, and really in colleges in general. Anywhere where you have a group of confined people who are sharing drink cups or sharing water bottles and those kind of things. So it's really important to avoid doing those kind of things. The effects of mono can be experienced for an extended period of time. My daughter had mono, and I know that she went through the very exhausted stage, and it took a while for her to really feel better. We're talking several months, and it can take that to feel better from mono. Mumps is a contagious viral disease. It manifests with enlarged parotid and salivary glands, and sometimes the sublingual and submaxillary glands. It is a rash that first appears on the face and neck, and then there's a scattered rash on the rest of the body. Generally involves children between 5 and 15 years of age. There's a 2 to 3 week incubation period, and it spreads through the air via infected droplets and contaminated saliva. Now, mumps is one of the diseases that's included in the MMR vaccine that children get as infants and toddlers, generally in 2 doses, one at 12 to 15 months of age, and the second one when they're between 4 and 6 years of age. And the MMR is a vaccination for measles, mumps, and rubella, and we're going to talk about some of those. Rubeola is regular measles or red measles. It is a very communicable infectious disease. It used to be, before the immunization was present, more than 90% of the population was infected before the age of 20. It is airborne through nasal or throat secretions of infected people. Incubation is about 10 days, and they're most contagious from 3 to 5 days before the rash. So measles, mumps, and rubella is the third. And rubella is German measles, also called 3-day measles, and it's also very contagious. Generally has milder symptoms in children and adults. It's acquired through the upper respiratory tract or through placental blood exchange. It can be really dangerous in unborn infants of expectant mothers. So if the mother gets rubella while pregnant, it can be pretty dangerous for the baby. They are contagious from the 7th day of exposure through the 21st day. Chickenpox and shingles are the varicella zoster virus causes chickenpox, and the herpes zoster causes shingles. So chickenpox is a viral communicable common childhood disease, and shingles is a reactivation of that chickenpox disease. They're spread by direct person-to-person contact, respiratory secretions, and varicella only. So respiratory secretions in chickenpox, and direct contact with fluid or indirect fluid on soiled towels or jerseys, etc. Chickenpox spreads pretty quickly. I think I discussed this in class, but just because you had chickenpox as a child doesn't mean you have an immunity to chickenpox. When you go to work in a healthcare setting, you're going to want to have what's called a titer done, which means they test your level of immunity. And even if you had the disease, you can still show that you are not immune to chickenpox. And you're going to be exposed, when you're working in a healthcare setting, you are going to be exposed to these diseases. So it's important to know that you have immunity. So if they do the titer, and it's just a test to determine if you have immunity to the disease. If not, they can give you the vaccination. This is something personally I had to have done. I had chickenpox as a child. When I first started my level 2 field work in OT school, I had to demonstrate immunity to chickenpox. I had the titer done, showed I was not immune, and ended up having to get the vaccine. So it's pretty common. This is just a chart that shows the duration of symptoms, how they're transmitted, the incubation period for the various diseases that we talked about. Moving on to streptococcal. The streptococci are small spherical chains of bacteria that are commonly found in human tissue. They're in the gastrointestinal tract, they're in the throat, they're in the respiratory system, the vagina, and skin. When these bacteria occupy areas outside of their usual habitat, that's when the problems arise. Strep infections are among the most common and dangerous infections and are spread from person to person contact. These are showing different strep infections. We've talked about some of them. And then the categories of strep infection, which we'll talk about A, B, and D in a sec. So strep A, suppurative infection. So suppurative means that they're generally involved in some sort of pus formation. And these are bacteria that can produce necrosis, which means tissue death, and inflammation. So things like tonsillitis, strep throat, impetigo, which is a bacterial skin infection, myositis, which is an inflammation of the muscles, pneumonia, and cellulitis, which is a bacterial skin infection as well. So those are all strep infection. Also, non-suppurative, so non-pus forming infections can occur in tissues away from the original bacterial attack, so you can get infections elsewhere. And then also group A is the flesh-eating bacteria that causes necrotizing fasciitis, which is a form of gangrene. So strep, as you can see, can be really serious. Group B are infections like hepatitis or the inflammation of the inner lining of the heart. Septic arthritis, so that's a painful joint, pneumonia, meningitis, osteomyelitis, you know what these are. These occur in patients with a lower resistance and also can be, generally are in the upper respiratory, gastrointestinal, and genitourinary tracts. Group D is a different group, often also in the gastrointestinal system, but can cause things like endocarditis, urinary tract infections, cellulitis, etc. So you're not going to need to distinguish between the groups of streptococcal infections for the final exam. I just wanted to include it so you know that there are classifications and categorizations of streptococcal infections.